Welcome, everyone. Thanks for joining us for today's Strengthening Families Networking webinar. Our focus today is on advancing a movement to promote early relational health and emotional connection. And this is part of our series of monthly webinars about strengthening families and related topics. It's an open invitation, so you're always welcome to join us and to share the invitation with others who are using the Protective Factors framework in your state or your community, or coordinating strengthening families efforts. I'm Kaylin O'Connor from the Center for the Study of Social Policy. We jointly convene these with the Children's Trust Fund Alliance. So my co-host Maureen Holliker is with us. You'll hear from her at the end of the call today. And each month we coordinate a different topic with guest speakers. We always welcome your suggestions or volunteers saying we're doing this really cool work. We'd like to join you. Let me know if you would like to do that. So we do this the second Thursday of each month, and just want to give you a sneak preview of what's coming up. On March 9th, we're going to hear from about a research project that the Alliance has been involved in recently called Supporting Parents at the Front End of the Child Welfare System, a close look at current status and recommendations for change. And then on April 13th, we're going to hear from CSSP's policy team about childcare and ARPA and what happens now for state budgets as we come towards the end of those federal American Rescue Plan Act dollars. So you can always mark your calendar for the second Thursday of the month, and we announce the topics as they get closer, and you can sign up for our newsletter to make sure that you are always getting those announcements. I'm putting those in the chat right now, the link to sign up for newsletters. So today we're going to hear from Becky Jakes-Hasek and Stephanie Albright from Health Plus Studios. And they're going to be sharing about a new movement to promote early relational health and emotional connection, which is pretty exciting, hot off the press stuff. And then we'll have updates after a Q&A time. We'll have updates from Maureen at the Alliance and from myself at CSSP. So with that, I'm going to stop sharing and hand over to Becky so that she can share all about this exciting new work around early relational health.
Thanks so much, Kaylin. I'm going to pull up a slide deck here. So give me one sec. All right. Can you see that okay? Great. Well, thank you everyone for allowing us to come to your space today and share a little bit about the work that we're doing. It's nice to see folks from all over the country and in Peru too. So welcome and thanks for joining us. Stephanie, my colleague, and I are from Health Plus Studio. Health Plus is a social impact agency. We work with mission-driven organizations to really help improve programs, launch new programs through strategy and communications work. So we have been partnering with the Center for the Study of Social Policy for about a year and a half now, really building a movement to advance early relational health and emotional connection. I wanted to start a little bit on kind of where we started on this journey and kind of where we are now. And we're really excited to be able to share with the Strengthening Families community about a new website that we've launched and a new brand that we've launched that's really all about how do we promote early relational health for all families across the United States and beyond. So where we began, we started working with CSSP, so David Willis, Kaylin, and others on the team, really to think about what's the core story of early relational health, meaning how do we talk about what it is, why it matters, what's getting in the way, and what we can do about it. And we thought by starting with kind of creating a unifying story and message for this topic of early relational health, we'll better be able to get people on board for what this is and talking about it in a similar way. We feel like having a strong strategic communications framework and messaging is really critical when we're doing this work around movement building. So we developed this messaging guide. I'll put the link in the chat in a second for this guide. We'd love folks to be using this guide. It's all about what early relational health is. How do you talk to different audiences about early relational health to get them excited about the opportunity of the impact on young kids and families when we can really build those strong connections between primary caregivers and babies and toddlers. So just to make sure we're all on the same page about what we mean when we say early relational health. Early relational health is a state of emotional well-being that grows from emotional connection between babies and toddlers and their parents and caregivers when they experience strong, positive, and nurturing relationships with each other. So I know many of you are doing this type of work. You're working on that relationship, that connection, that dyad between a caregiver and child. And this is just another way to describe this connection. And there's so much research that shows how critical those relationships are in healthy development, and that children are impacted and affected by the environment of relationships around them. So by defining it in this way, we hope it's large enough that folks see themselves in this kind of area of work, yet defined enough that you know what we're talking about when we're using the term early relational health. So from our work, really creating a core story, messaging, really ensuring people understand what we're talking about when we say this term, it was very clear that there's a whole lot of work going on around early relational health, from pediatrics to dual work, community health workers, early childhood, other kind of public health systems who are trying to support that connection and that relationship between parents and their children. And David Willis had started to gather all these leaders together under CSSP to learn from each other, start connecting them to each other. But it was very clear we needed a more strategic framework or pathway to start building a movement around this. How do we start connecting people doing this good work to learn from each other, to leverage each other's work? How do we spur new work in new communities to ensure that all families are experiencing this transformational power of emotional connection? So the Center for the Study of Social Policy really is the hub of this movement. They've conceived this movement. They're the organizers, the driver of this movement. But we know that if we're doing this kind of movement building where we have this collective vision that all families are experiencing early relational health, we cannot do that alone. So over the last about 8 or 9 months, Health Plus Studio has gone on a journey with CSSP to really develop a body of leaders who are driving this work, who are setting a vision for it, creating a mission for our work, creating an action plan for what the strategies and goals over the next year are to build a growing, engaged, and networked movement. So to begin with, CSSP, along with Reach Out and Read, created the Early Relational Health Family Network Collaborative. This is a really unique structure of how we engage parent partnership and parent voice in this work. That network has 6 parent leaders from across the United States. It's facilitated by Bryn Fortune. Each of those 6 leaders from across the United States represents a different race, ethnicity, different focus on child special needs, for instance, a different geography as well. We have folks from Southern culture. So we have lots of folks who bring varying expertise and perspectives on this work. Those 6 parent leaders then reach out to 10 folks in their community to bring back the insights of a total of 66 parent voices. So this group has been absolutely instrumental in shaping this movement and shaping all of the communications materials that you see today, and really ensuring that the parent voice is centered in all of the work we do. From there, we developed a steering committee to really figure out, how do we guide this work? How do we build a shared understanding of what's currently happening around early relational health? What are the barriers? What are the opportunities? Where is some really good work happening? So that steering committee includes 3 folks from the Family Network Collaborative, as well as funders, researchers, pediatricians, systems leaders, et cetera. So it's a really diverse group of folks that have been working together over the last year. And really all of the work that's captured on the website we're going to share has been led by the steering committee in this group. And then finally, we have a national early relational health network. That's about a group of 50 or so folks, different leaders from across sectors, who all have a stake in this, who are all part of this growing movement. So just to say that all of the work that you're going to see today is really capturing this kind of distributed leadership model. Now, as we've gone along on the work to kind of figure out who are the right people, how are we bringing them along, we knew we also needed to create a brand around this movement. We needed to name it something. We needed to have visibility out in the world. So the Health Plus Studio, alongside the steering committee and the Family Network Collaborative and CSSP, started building a brand around this. What's our brand narrative? So what does this brand care about? What does it stand for? What should we be doing? How will be different in the world? And really thinking about what's our brand personality and what's our voice? What's our brand voice? We also went through a process of actually naming the initiative, naming the movement, which was a long process with a lot of input and a lot of folks coming together to ensure that the name of this really resonates and can resonate with a variety of groups, from parents to professionals to community workers, right? That they could see themselves in this name. So with that, we landed on Nurture Connection as the name for this movement. We then went through a process from our brand narrative, from our personality and our voice about what's our visual identity going to look like. So we've chosen this color palette you'll see here. This logo looks like two people embracing one another. It has the colors that are vibrant and energizing and really reflective of young kids and the joy that they bring to our lives and the joy it is to be a caregiver. And lots of different design elements to kind of make it fun and bring it to life. So you'll see our colors there, our fonts, etc. So all of this maybe for those who love the branding or the strategic communications can kind of get lit up by this, but it was a really fun process to think, what is this brand? How do we bring it to life? So with that, what we'd love to do now is actually share our brand new website. It was just launched this week. It was just launched formally on February 6th. We've been working on it for so long. It feels like it's been out in the world for even longer than that. But what we'd love to do is show you the website. It talks about kind of who we are as a movement, the different work, the resources, and then opportunities for all of you to join that movement with us. So I am going to turn it over to Stephanie to take you through the website.
Terrific. Thank you, Becky. I'm going to share my screen now and give you guys a bit of a tour of the Nurture Connection website. Like Becky said, I am a colleague of hers. We work together at Health Plus. My main focus was on the communication strategy, doing that branding work, and figuring out how it would have a physical identity to the world, as well as working as a team to really be cognizant of the words we chose, the framing we used for all of these topics that fall under early relational health. So without further ado, I'll share my screen. And so our URL here is nurtureconnection.org is where you will find us. And let me bring this down so I can see it. All right, everyone, I hope can see my browser here. So our homepage features, oops, I'm just trying to make this a little bigger. There we go. Okay, so our home page here features this adorable baby, of course. We really focused, you'll see throughout the website, we really spent a lot of time and thought and really talking with our partners in these various networks that Becky was talking about. It was very much a collaborative effort to say, what type of imagery should we show that we want to be reflective of Nurture Connection, the movement, ERH. So you'll find throughout that there's a real effort here to make sure we include all different types of people, all different types of babies, representing hopefully that families come in so many different shapes and sizes and colors and abilities and everything like that. So we really hope to represent that as much as possible. Also, we want to show that caregivers aren't always just a male and a female, are not necessarily in a specific age group. Grandparents can be caretakers, siblings can be caretakers. It runs the gamut. So we want to make sure we were inclusive. So what we have here is this a nice header image of this baby with a quick little blurb about Nurture Connection as a movement and what we're here to do. We made a point here to have a navigation bar up top that will stay there no matter where you go through the website, so that whenever you want to say, okay, this is great, but I'm really interested in family partnerships, I'm really interested in getting resources, you can go straight there. So we have two pictures up here on our main page, our home page. The second one being focusing on the leadership was the big part of it. Like Becky said, this is a huge collaborative effort, networking with so many different stakeholders from all across the country. So that's another point that we put right up on the homepage. So you'll see here as I scroll down, we hit our framework of the website was to kind of give a little blurb. And then if you want to read more, we have these clickable buttons and links where if that's an area of interest to you, you can go deeper on that. So we have a little tease. This is an important part, using families as our partners in this process. So that gives you a link here. It's going to connect you back up. And you'll see throughout the website here, we have what we're calling we call it a barker, which is kind of a call to action, giving an opportunity to join Nurture Connection. And I'll click on that a little bit later and you can see what that means. We have a resource library that is growing and it's always going to be a work in progress. We'll continue adding to it. So I'll show you that in just a moment, but these are just 3 starter articles, resources that you can go to. And then we've created a global footer. So again, you have more opportunity here at any point just to jump to the parts that are of most interest to you. So that being said, I'll take you to the About Us section. And we have what we call a gateway page here, which is kind of a general overview about Nurture Connection. Again, using these quick couple sentences on each. These flip over when you hover over them. But if you want to go deeper, you can, and it will take you to another page. So for example, I can go here About Us. Maybe you want to learn more about who we are and what's going on. So there's more details in here. We've scattered blogs throughout the website in the different, depending on topic, the section we think it fits with best. So we put in here, for instance, this one is a conversation with the Family Network Collaborative that Becky mentioned earlier. So that's a really interesting blog. If you have a chance, you can click on that. It'll take you straight to it. You can also find it in resources. So, and a little bit here about our leadership. There, like Becky said, there's such a collaborative effort. We talk about our origin story this way. We can also, by clicking on some of these, we can get more details about exactly who these parent leaders are, for example, who exactly is a part of the ERH network. Well, click on that and it will give you a full list of names. As you can see, a lot of people. And then, so that's telling you about Nurture Connection and how we came to be. So this next section really dives in deeper into ERH, because that's the core issue area here that's at the movement center. So we really wanted to make it clear to our audiences that if they're coming to this for the first time, even if they know nothing about ERH, they can learn more about it here. So we'll explain more, for example, the core story of ERH, why equity is so important in this movement. So we can learn more about that. The reason we exist. And again, reminding you, if you would like to just join Nurture Connection, you have the opportunity there. So this is the overview page. We can get more deep into it. Like if you're interested in the equity mandate, we have a page that is dedicated just there, and it dives even deeper. So these are some examples. And I will then go over to our family partnership, which is an important page, and really making sure that the voice of parents and caregivers are heard. So you'll find here some interesting quotes that caregivers have shared with us on various parent perspectives. And then again, another link to that blog. So for example, if you click here, it should take you, it's thinking, my slow internet figures. There we go. It will take you to this blog and a different viewpoint. So if you want to read specifically from the point of view of parents talking about ERH, this is an interesting blog article we have up here, for example. And then in our work section, I'll give the overview, but as you can see, it breaks down even more detail into each of these topic areas. That's a part of our strategy. So in our work, giving the overview here, focuses a section focusing on building connections, raising awareness, building an understanding, trying to make sure everybody's sharing evidence-based tools with each other, talking about a cross-system commitment across sectors, advancing policy section, And we're going to be having new blogs coming out. For example, we'll be adding new content to this website, so we hope to keep it growing. So for example, we have a blog that's being drafted right now from someone who is going to be more of an expert in the policy area, and we'll be speaking more directly to that. So coming soon, we will build out these sections with more information and hopefully value for the reader. So that's an overview of our work. And then I'll show you our resource library here. You can do a search here, so you can browse, so you can look at filter by the type of resource you're interested in. If you want to look at videos, publications, if there's a particular topic that interests you, you can do it by then. Or you can just search if you know the name of the article you're looking for, any part of it, you can go into the search function. And we've got a lot of great stuff in here. And like I said, it will always be continuing to grow and build. So the join nurture connection, our big main button that we keep reminding everybody. So right now, when we say join nurture connection, that call to action, what we're meaning is just we want people to start engaging. We want to sign up and hear from people who are interested in learning more. We're really interested in finding out, well, what fields are they coming from? What interests them? So this is an opportunity if anyone is interested in receiving what right now is our Nurture Connection newsletter. It's spearheaded by Dr. David Willis. It's not a new newsletter. It has been, he's published about 15 with CSSP under the header of the ERH newsletter, but now we're shifting it over here to Nurture Connection. So it will be the same type of content focusing on ERH. So for those of you who have been receiving it, you'll continue receiving it, and we'll be covering much of the same information. If you're not signed up for that yet, we do encourage you to come on over here to join and receive that really great newsletter. It comes out once a month. Another way you can join and participate at this stage is we encourage people to sign an open letter. It's kind of like a pledge or showing interest and enthusiasm for the movement. So it basically just gives you a chance to add your name to the list. And again, you don't have to, you can be more anonymous if you'd like, but we're really interested to know where people are coming from and where people are joining us. And also very interested in knowing what's your area of interest and how are you coming to the table in this big movement. So there's an opportunity there under join. And also, of course, you can share on your all respective social media channels. If this is something you feel you want to get out to your network, that's super helpful. And then finally, the last couple bits we have is that if you have any questions or comments or thoughts, you can just send us the equivalent of an email. It'll come through us as an email here. And finally, we have a funders section here where we're really focusing on how and why you can invest in Nurture Connection and why we feel this is such a salient issue area to support. So we have a few articles here making that case. And we have also a blog here from Einhorn Collective, who's is a huge supporter of ERH and Nurture Connection. So there's a blog post here that goes into that further detail. And of course, we just have a general search function here, which is just a useful tool. If there's anything specific you're looking for and you want to get right to it, that will take you there. And so I think I've covered all the basics. So happy to, I think if there's any questions either about specifically the website, even if it's about developing it or specific questions of why we use certain things, or any questions too about what Becky had, when she set the table of how we came to create this movement. We'd love your thoughts, questions, concerns.
I just want to share, thanks, Stephanie, that, you know, we see this as the first kind of really digital presence and home for this work and this movement, and hope also that obviously sections like the resources and things can be useful to the field in terms of understanding kind of best practices or just tools and guides, research reports that exist that can help promote early relational health. So we see this as a place that we can all come to. And just to say the intention, as we're speaking to all of you doing all your great work in various communities across the country and beyond, that we really see Nurture Connection as a really big tent that many people hopefully find their place in, because even though you may not call your work supporting early relational health, most likely you are using practices and ways of kind of interacting with children and families, just based on the framework, that are all about promoting that relationship, recognizing and respecting the strengths of the family, right? So just to say that all are welcome in this movement. And also that we're continuing to, as Stephanie said, add to this website. One of the things on the agenda for the coming year is really highlighting bright spots. So where is there really good work happening across the country where kids and babies and their caregivers and families are supported, are receiving services and programs that really make a difference in our lives. And we'd love to highlight those on this website, so other folks can find you and we can make more connections. And as Stephanie said, we're going to continue to do blog posts and others. So there may be more opportunities via the website as well to kind of connect and leverage each other's work and learn more about the great work that's happening across the US. So yeah, Kaylin, I don't know if you want to.
Well, I see someone just typed in the chat, is there a Facebook page? Can people connect on social media, or right now is it just the website itself?
So right now we haven't set up social media channels yet. This is our first major channel of communication with the website. But we would love partners, family, friends, everybody in this network who's interested in this type of work and getting the word out. We would love for you to post on your respective channels, and up on the website, I believe under the contact us, there's a chance you can just do one click on whatever your social media channel is, and it will take you to that. The other thing too is I just wanted to mention, and we have put together a bit of a marketing toolkit so we can make it very easy. If it's something you want to talk about, we have some images that are ready to go for all social media channels, as well as potential captions. So if it is something you would like to share on social media, we have all those tools, making it as simple as possible for you.
Great, thank you. And I see that Lisa Johnson put a question in the Q&A about connecting with Brazelton and the newborn behavioral observation system. So I wonder if you can answer both for Lisa specifically in that intervention, but for others who might be in a similar position of how they might be able to connect.
Yeah, thanks, Lisa. And absolutely, we know of your work, and there's a lot of alignment and interest from, I know, our group. On our steering committee, we also have Danny Demetrio, who's at the Nurture Science program, and they're doing a lot of work, obviously, around observing and measuring emotional connection, and then also our Reach Out and Read partners thinking about how early relational health shows up in a well child check visit as well. So yes, we would love to connect with you. The best way to do it is through the website and the contact us form. That sends us directly an email. And then we'll be able to connect that way. That would be the best way to do it. And please, if there's others that you feel, knowing the work that we're doing, knowing some of the people who are on some of these lists of the steering committee, the ERH National Network, we'd love to continue to connect and find ways to collaborate. And just to say, as we think about the next year, one of the key strategies we've been employing over the last 5 months or so, really driven by the steering committee that I mentioned earlier, is this idea of listening and learning sessions. So we have a great group of people on our steering committee. It's 12 people, right? And we have 66 parents sharing information with us, but we know there's so many other communities and leaders that we need to be hearing from. And so we'd love to also, through that contact us form, if you have something going on in your community that you feel like we got to know about, or we have to learn from, or we have to connect with, please reach out to us via the website, because we've been conducting their virtual sessions. They're about 60 minutes. We have a set of questions that we ask, and we just get to learn and listen about what's happening out there, and how does that kind of then inform our own strategy and our own thinking as we continue to build this movement. So we'd love to hear from you.
Well, while it's a bit quiet in the chat and the Q&A, I'm going to ask a question, but I'm going to ask the question of our audience. which is those of you who are already deeply engaged in strengthening families work, which I know is most of the people who participate in these webinars. How do you see this connecting? Do you see using nurture connection language or resources in your community or state? You want to go the other direction and just attach to what they're doing? Any thoughts you have about it? As many of you know, we are working on a refresh of strengthening families materials where you will see language around early relational health much more prominent. We are connecting these two initiatives much more. So I'm curious to hear what you're thinking at the state or local level. And folks can type into the chat, or if you would like to raise your hand, we can unmute you. All right, I see Maureen Durning in Idaho has written in, it's a perfect fit. We'll include ERH info in our trainings in Idaho and beyond. And Julia Torquati says, I will use in my classes with pre-service early childhood educators. Tish McInnes is on. Hi, Tish, who's also a part of the Family Network Collaborative. She says, nurture connection touches each protective factor. Exciting time for strengthening families, for sure. I also see, I want to keep monitoring those responses, but I see someone did type in a question. So Marlo Nash is asking, are there any specific federal policy goals at this point in the campaign?
I can take that. So we do have a policy work group that is organized around early relational health and embedded now within the Nurture Connection movement. If you navigate to our work section, and then there's the policy agenda, you'll see one of the key resources we have is actually an ERH policy agenda. And I'm going to share my screen just quickly to pull that up. To share with folks. So here's the agenda itself. It talks a little bit about the issue area and the opportunity given ARPA dollars to many states or to all states. They also have these kind of primary policy goals to advance early relational health. So you'll see here equity, economic security, provider training on ERH, services to promote ERH, supporting a relational workforce, high-performing medical homes, parent, infant, and early childhood mental health, and early childhood system. So these are the goals that they're working towards. In terms of policies that they're supporting or pushing, not surprisingly, these are all policies that will better support the relationship between the caregiver and child. So we have paid family leave here, furthering a child allowance, postpartum Medicaid coverage, and an investment in community health workers. We've been doing a lot of work around supporting community doulas as well through this work, and primary care child development. So you'll find more details here, but we do have a really experienced and exceptional team of policy experts and consultants working the policy agenda alongside the research and practice change and systems change work as well. So hopefully that's helpful.
Thank you. I see we have a couple more comments in the chat. Lynn Ayers typed, we have a community collaborative focused on child abuse prevention. One of the standing committees is early childhood supports, and a lot of that work is focused on childcare. I've already shared out with the leaders of that group to include resources. And then Rachel Taylor wrote, yes, even outside of my professional work, my community consists of a large number of young parents. I'm always being asked for resources. I think this will be great, keeping up on y'all's development. And Maureen Durning says ERH is particularly useful in home visiting situations where we're doing that one-on-one work with families.
Great, thanks. Yeah, Maureen, I know Dr. Willis is also very engaged in home visiting and the national home visiting work as well. So I'm hoping we have more connection there. Currently, we don't have anyone on our steering committee working in home visiting, but I think that's a ripe opportunity and area for us to be engaged more. And I did want to say, Rachel, young parents, parents who are Gen Zers, our parents were really interested in learning from more in this movement. So if you do have, young parents who are younger on the younger end, we would absolutely love to connect and see if we could set up maybe one of those listening and learning sessions. We were just having an email chain of all different maybe groups or opportunities to connect who really are linked in with parents of a different generation than even myself. So I think that feels like a really interesting group to begin learning from and figuring out how do we better support them through this movement.
Great, thank you. And I was just trying to scan to see, I know David Willis was on the call earlier. I think he's still here. David, I don't know if you want to comment at all on your excitement about this launch of Nurture Connection and where it's going next. Are you there and able to unmute?
Well, look at that. I can unmute. Hi, my friends, and hi, my friends in Strengthening Families Land. You can imagine how excited we are about this, the beauty of the website itself, but more importantly, the movement building and the resonance that Nurture Connection has from so many sectors to this work, focusing deeply on connections, focusing deeply on supporting the youngest of families, focusing deeply on flourishing builds from there. But that's a movement, so it's not any one sector, it's all of us together. So we hope that with this website and making visible as a living, learning, growing network, that where we can show what's moving in the field, but we can also show blind spots as they're emergent. And as there are the formal and informal learning systems that see the power of connection and what it generates for families. In the center of all of this is equity. In the center of all of this is, building the strength of next generations in safe, strong, and protective way, but also with deep respect and with deep value of historical, cultural, and traditional patterns that are meaningful to families themselves. This is not about fixing broken families. This is all about the structures around families that make it really difficult for them to be successful, to the relationships that matter most to them every day. And so join us. So thanks for the opportunity.
Thank you, David. I see that Rachel did put her contact info in for you, Becky. So let's see, are there any other questions in the group? I see people are sharing groups they're sharing this out with. So Lynn Ayers said shared with our community response coaches who do home visits with high-risk families. That's an excellent population to reach with that. And Fernando says we'll see how to adapt and use it in Peru, which is very exciting. We'd love to come visit if you need help there. Just let us know. Let's see. I think those are all the questions we have so far.
We do have a new one actually in the Q&A from Julia.
Great. Oh yes, Julia asking for clarification on that. Would you be interested in Gen Z parents for a listening session? It sounds like it.
Let me unmute myself. Yes, Julia, we'd love that. I think given our current Family Network Collaborative, there are some Gen Zers as part of that network, but we'd love to hear from more. We just feel like they are a really critical group to help support as they're now raising the next generation that hopefully are healthy and productive and all of that. So yes, if you want to reach out, if you want to share your email here or go through the Nurture Connection website and contact us and just note that you're working alongside kind of younger parents or teen parents, that would be great. Thank you.
Yeah, and I know I, for one, think a lot about, and I know, Becky, you're in the thick of this, but even those of us who have even slightly older kids, the experience is so different with children born or very young during the pandemic that I think we just need to hear the voices of parents who have infants and toddlers right now, because it is such a different experience. So there's different factors influencing that. Okay, I don't see any more questions coming in. We welcome any comments now or added on later, but maybe I'll check and see if Becky, Stephanie, or David, if you have anything else to add before we move into our updates.
I don't think so. I think just thank you for the time and the space to share this new exciting work. We're incredibly proud and excited to have this out in the world, and very much hope that folks can see themselves as part of this and find a place in this movement to help kind of continue to grow and spread the word about how critical it is to support young babies and toddlers and their caregivers as really the bedrock of what's going to make a healthy and resilient society and community. So I know you all are doing that work, and we look forward to hopefully connecting with you all and hearing more about your own journeys, your own work, and be able to highlight that through this growing movement. So thank you very much.
And I'll echo that. So thank you all.
Thank you so much. And I see David saying yes and help us make it better. I see Linda Manna saying this is a tremendous resource for us as we begin implementation of our ARPA grant project in Oklahoma. So we're really excited to see all the places that this is going to have an influence and all the ways that you're going to find to use it. All right, thank you, Becky and Stephanie. I'm going to hand off to Maureen to share some updates from the Children's Trust Fund Alliance, and then I'll share some updates from CSSP.
Excellent. Thank you so much. And wow, amazing website and amazing resources. And we're excited to use all of those in our strengthening family efforts and through our training. So thanks, Kaylin. If you can advance, the next slide is just about our upcoming training of trainers for strengthening families. We are really excited to have over 1,800 trainers now across the country. It's been 10 years of the training, and we're coming out with a lot of new exciting materials. So if you or someone you know is interested in becoming an Alliance certified trainer, you can contact us through the CTF website, or you can scan the QR code. And then, Kaylin, the only other bit I have for us is the next slide is letting everyone know that this is National Parent Leadership Month. And the ANPPC, which is the Alliance National Parent Partnership Council, has a huge amount of amazing resources through social media. They have certificates that you can give out. They have information on how to have a proclamation made in your state. So you can contact them, and I will put it in the chat at ctfalliance.org through the Parent Voice tab. And that's all I have, Kaylin.
Thank you, Maureen. And I will share a few updates from CSSP. First is a paper that just came out called Rescuing Childcare. The American Rescue Plan Act's Positive Impact for Families. This is based on interviews with parents, family members, and providers about how the ARPA funds have really made a difference in childcare. As you may have caught the connection, our April webinar will focus on what's going to happen next as those ARPA funds run out in the next state budget cycles and how states will or will not fill those gaps. So this paper is one that's definitely got a point to make about the importance of these funds and advocating for continuation of that type of support to keep the childcare industry running. So hope you'll check out that paper. I just put the link in the chat with a couple other things, and join us for that webinar in April as well. And I also wanted to share another paper that just came out, the Dulce approach to setting goals with families of infants. Again, very related to early relational health. Dulce is an early relational health promoting model in the pediatric setting. And they just released this report about work that they did over the past year or so about really talking with parents and caregivers about their goals in the context of well child visits. So they learned a lot through that process and have a lot to share about what parents and the family support specialists in those pediatric clinic settings shared about how asking questions about goals and working with parents to set goals really changed the tone of those conversations. So another great resource. And also, I hope many of you have already heard about this. Coming up at the end of March will be the third Hope Summit with a focus on practicing hope. And that'll be March 29th and 30th. It's virtual, so you can participate from anywhere. It has a low cost registration, so I hope you can do that. some of us who have been talking at you today are also going to be speaking at that summit, including I have the pleasure of presenting some breakout sessions about the relationship between hope and strengthening families with Holly Wingard from Michigan. So I hope that lots of you will join in that conversation. And along those lines, I also wanted to remind something that I shared on our previous webinar, but a new graphic that where we're really trying to demonstrate how strength-based approaches lead to positive outcomes for families, whether that strength-based approach is strengthening families, early relational health, help me grow, hope, Dulce, many others that we could list, but those are the ones that we put in this instance of this graphic, that those types of interventions and ways of working with families build parents' protective factors or help parents build their protective factors, which leads to more nurturing families where children are more likely to have strong early relational health, have a higher likelihood of positive childhood experiences, lower likelihood of adverse childhood experiences or ACEs, and are more likely to be buffered from toxic stress when they do go through some adversity. And that leads to outcomes that we all want of thriving children. And we nest all that within the concept of supportive and equitable communities so that these things are more likely to happen when we're in communities where there's a commitment to making children and families a priority, where quality services are meeting the needs of all children and families. Families live in neighborhoods where they can thrive. There are policies that support and are responsive to families. And there are targeted efforts to reduce poverty, advance equity, and improve those social determinants of health. So we bundled it all up in one graphic, and we're excited to get that out in the world. And that is part of what we'll be talking through in those breakout sessions at the Hope Summit. So it's all connected. This graphic is actually featured in a paper about the alignment between strengthening families and help me grow, which many of you also are very familiar with. So I encourage you to check out that paper if you haven't seen it yet. It includes that graphic and some current definitions of, we're in the midst of updating definitions of the protective factors. So you'll see our current working definitions and some other of the new language that we'll be using about strengthening families as we move forward. So I encourage you to check that out. And then of course, join us for our next webinar on it is February now, so that'll be March 9th, which will focus on that research done by the Alliance with parents about their initial contact with CPS. Of the front end of the CPS system that we don't often actually hear that much about how those interactions go. So lots of exciting stuff coming up. I see Maureen Durning's suggestion, a future topic of how to get this kind of information to lawmakers. And that is a great one. We should probably plan that for sometime later this year. So thank you all for your engagement today. Many thanks to Becky and Stephanie and Maureen for joining us and presenting, and just always grateful to see you all. Thanks for joining us. Thanks, everybody.